Tonight, we are getting a closer look at what the strike teams headed to Stanislaus and San Joaquin counties might look like.
Their work will be similar to what's going on down in Imperial County. CBS 13's Marissa Perlman live at the Capitol with more on what we can expect to see. Marissa.
Yeah, Tony, Governor Newsom announcing this major initiative this week, which in part deploys these strike teams to both Stanislaus and San Joaquin County. It's much like what we saw in Imperial County, a coronavirus hotspot, more than 4 weeks ago. But tonight we're looking into whether these strike teams really worked in Imperial County.
We've heard this term strike team for 2 days now. Really don't have an understanding of what exactly that means.
Leaders in Stanislaus County looking for answers on what a strike team may look like. So they're pointed to rural Imperial County, which the state identified as a coronavirus hotspot more than a month ago. The goal there was to reduce transmission rates, augment surge capacity, and bring an 80-bed alternate care site to a county needing support staff at overwhelmed hospitals. It's the same support leaders in Stanislaus County say they need now.
Two of the hospitals in our county have made requests for additional staffing, and that comes to the County Office of Emergency Services and gets funneled up to the state and potentially to the federal government.
The County Office of Emergency Management says they've looked to Imperial County to see if deploying these strike teams there worked. The state says yes. After strike teams were sent in, the state says the 14-day case rate dropped by 63% from more than 830 to just over 300. State leaders say the strike teams helped with contact tracing and managing outbreaks at workplaces. CHHS Secretary Dr. Mark Galley didn't take our questions on how the strike teams would be used in the Central Valley, but over the next few weeks, he says the state will have a hyper focus on these 8 hotspot counties.
We believe over the next many weeks, these efforts, just like we did with Imperial County and that strong, deep partnership to reduce positivity rates, transmission rates, case rates, we expect these next 4, 6, 8 weeks focused on the Central Valley.
We did hope to hear directly from health leaders in Imperial County about whether they felt like these strike teams deployed there were successful, but they were not available to speak with us today. But they did tell us much of the resources they received went into messaging and managing resources, something that leaders in Stanislaus County say they already have handled.